the newborn is a very important thing which has to be discussed at the time of discharge. So, whenever you take the baby home after the delivery, you have to take care of a few things. First of all, you have to exclusively breastfeed the baby. Exclusive breastfeed means that you do not have to give the top feed. First day or the second day is okay if the mother's milk is not enough and the baby mother's breast is very soft and it is not producing milk, then you can give once or twice. But then you should give exclusive breastfeeding, no water to the baby, whether it is very hot summers, or and no honey to the baby, whatever is the culture and the religion of the baby's family. So, breastfeeding is to be done exclusively. After every breastfeed, the baby has to be given burps. The baby has to be put on the shoulder, and slowly and gradually, the baby will start taking burping. And then, after the burping, the baby has to be laid down on the bed on the baby's cot in the lateral position. That means that the baby's turn should be on right side or the left side. It should not be laid supine. सीधा नहीं लिटाना है बेबी को. That is very important because if the baby vomits, then the baby's vomitus, the baby what the baby is bringing out of the abdominal cavity should not go into the respiratory tract, and that should come out from the mouth so that the baby does not aspirate. Then the next thing is the baby's bathing should not be done. It should be only wiped with a clean cloth. No exposure to visitors from outside, even if you have to massage the baby after 7 days or 8 days, then the grandmother has to do that job. Adequate sun exposure should be given to the baby because it has a role in decreasing the chances of physiological jaundice, which is there in the babies. Then we have to watch for yellow discoloration. If the baby is looking yellow, the skin is yellow, the eyes look yellow, then you have to bring the baby to the doctor. On the seventh or eighth day, you have to bring the baby for routine check. But before that, also, if the baby looks yellow after the discharge, then you have to get the baby to the doctor, to the hospital. Then there's some of the danger signs are that the baby is vomiting more. Whatever you are giving, breastfeed or top feed first or second day also, then you have to bring the baby to the doctor. If the baby is very sleepy, the baby is demanding less feed, and the baby is urinating less, and the baby is also defecating less. It is not passing motions properly. Ideally, the baby should pass motion after every feed sometimes. Yes, 6 to 7 times it does pass, and initially it is black colored and then it becomes a little lighter in color. So if the baby is demanding less feed, then it is okay. Then one very important thing is the baby should be given demand feeding. The baby should not be woken up at night to give breastfeed, because then you are spoiling the baby's habit of sleeping at night and letting you sleep. So in the morning, if the baby is not demanding for 2 to 2.5 hours, then you should not disturb. But then even if the baby is not demanding during the waking times in 3 or 4 hours, 5 hours, then you have to look what is happening with the baby and you might consult the doctor after you are discharged. So happy parenting, happy caring of the newborn, and congratulations once again. Thank you.